Hello everyone, and welcome back to Hello Word. I am Alex, your ever-enthusiastic host and companion on this language learning journey. Today, we have a very special episode lined up for you, where we will dive into English words and phrases that are commonly used in hospital settings. Now, I know that hospitals can sometimes feel overwhelming, especially if you are in a place where English is widely spoken and you are trying to get the medical help you need. Learning these words in advance will not only boost your confidence, but it will also help you communicate effectively when clarity and calmness are most important. Over the course of this episode, we are going to explore several terms that you would encounter in different areas of a hospital, from basic objects in a patient's room to broader departments and procedures. This approach will give you the practical vocabulary you need to make your hospital visits less stressful, and it will also expand your overall English proficiency. Before we jump into the specifics, here are a few learning tips to keep in mind. First, do not rush. Take your time and repeat the words out loud until you feel comfortable. Hearing your own voice can be a great way to reinforce your learning. Second, try to picture the scenarios in your mind. If we talk about a hospital room, imagine yourself walking in, seeing the objects we describe, and using the words to name them. Visualization is a powerful tool for memory. Third, do not be afraid to make mistakes. Language learning is all about practice, trial, and error. Finally, remember to have fun. The more you enjoy the process, the faster the words will stick in your mind. Let us begin our exploration of these essential hospital words together. A hospital room is the space where patients stay during their time in a hospital. It often includes a bed, some chairs, and various medical equipment to monitor and care for the patient. People usually refer to this space when talking about where a friend or a relative is staying. In everyday conversations, you might say something like, "I visited my uncle in his hospital room last night." Another example could be, "The nurse escorted us to the hospital room after we checked in at the reception desk." It is typically a private or semi-private area where a patient receives treatment, rests, and recovers. Imagine yourself walking down a corridor, looking for room 10, and the sign on the door says hospital room. That scenario helps you connect the term to a real-life setting. A single room is a hospital room designed to accommodate only one patient. Patients who require isolation or who prefer a quieter environment might stay in a single room. In casual conversation, you could say, "I am relieved my mother got a single room for her recovery because it gives her privacy and calm." Another possible example is, "The doctor suggested a single room for better infection control." This term reflects a situation where there is no sharing, so the patient can have privacy and reduce disturbances. Single rooms can also be beneficial if someone needs close monitoring or minimal contact with other patients. A bedside table is a small piece of furniture located next to the patient's bed in a hospital. It offers a surface to place necessities such as water, medication, books, or a phone. You might hear someone say, "Can you hand me my glasses from the bedside table?" Another person might say, "I always keep my phone and a few magazines on the bedside table so I can reach them easily." Although the term bedside table is frequently used in home settings as well, in a hospital context it is especially important because patients often cannot move around freely. This small piece of furniture can make a big difference in a patient's comfort and convenience. A hospital bed is a specially designed bed for patients. It can be adjusted to raise or lower various parts of the bed to optimize comfort and assist with medical needs. For example, you might say, "The nurse showed me how to adjust the hospital bed so that my grandmother could sit up straight during meals." Another possibility is, "He pressed a button to move the head of the hospital bed up for better breathing support." These beds often have side rails to provide extra security for patients, especially if they have limited mobility. The design of a hospital bed caters to both comfort and practical healthcare measures. An overbed table is a small table that can be rolled or slid over the patient's bed. It has a flat surface on top where a patient can place food trays, books, or electronic devices. In a casual conversation, you might say, "I put my laptop on the overbed table so I could watch a movie while resting in bed." Or you could hear someone mention, "The nurse brought lunch on the overbed table, and it was right at the perfect height." This type of table is especially useful for people who have trouble getting in and out of bed or need to keep certain items within easy reach. A privacy curtain is a curtain used in shared hospital rooms or areas to separate one patient's space from another. It ensures that each individual can have some personal space while receiving care, changing, or discussing private matters with medical staff. You might say, "The nurse pulled the privacy curtain around my bed before helping me change my clothes." In another instance, a person might report, "I felt more at ease once they closed the privacy curtain." The idea of privacy is crucial in healthcare settings, and this curtain is one simple yet significant way to safeguard a patient's personal comfort and confidentiality. An IV pole is a tall, movable stand that holds intravenous bags used to deliver fluids, medication, or nutrients directly into a patient's bloodstream. People often notice the IV pole when visiting a patient because it is right beside the bed. You might hear someone say, "I had to wheel my IV pole with me whenever I walked down the hall." Another example is, the nurse hung a new bag of saline solution on the IV pole. This piece of equipment is essential for delivering consistent medication or hydration without requiring constant injections. It is a familiar sight in most hospital rooms. An emergency call button is a button that patients can press if they need immediate help or attention from nurses or other hospital staff. Typically, it is located close to the bed, so a patient can reach it easily without getting up. In an everyday situation, you might hear, "If you feel dizzy or have any pain, press the emergency call button." Another person could mention, "I pressed the emergency call button in the middle of the night when my mother's fever spiked." This device is a crucial lifeline for patients who might be unable to leave their beds but still require urgent assistance. To be admitted means to be accepted as a patient in a hospital or medical facility. This is the process by which a person officially begins their stay for treatment or observation. You might hear someone say, "I was admitted last week after my accident," or "My doctor decided to admit me for overnight observation." Another example might be, "He was admitted to the hospital because of severe chest pain." When you are admitted, you go through paperwork, get a room assigned, and begin your journey of receiving medical care within the hospital. To be discharged means to be officially allowed to leave the hospital. Once you are discharged, you can return home or move to another form of care, depending on your condition. In daily conversation, you might say, "I was discharged this morning, and I feel so much better now," or the doctors say she might be discharged later this week if her tests are normal. Another example could be, "The discharge process took a couple of hours, but I was happy to finally go home." Being discharged is typically a positive event, showing that a patient no longer needs continuous hospital care. An outpatient is a patient who visits the hospital for treatment or tests, but does not stay overnight. Outpatients come in for medical procedures, consultations, or routine checkups, then leave the same day. You might say, "I am scheduled as an outpatient for my physical therapy sessions," or "She only goes to the hospital as an outpatient every other week for chemotherapy." Another example could be, "Outpatient procedures can be more convenient because you can return home the same day." Outpatient care is especially common for minor surgeries, diagnostic tests, or treatments that do not require prolonged observation. An inpatient is someone who stays in the hospital overnight or for an extended period to receive medical treatment. If you need surgery that involves recovery time under supervision, you might become an inpatient. In everyday speech, you could say, "My grandfather became an inpatient after his hip replacement surgery." Another sentence might be, "I was an inpatient for 3 days following my accident." The term emphasizes that the person is staying inside the facility for ongoing treatment and is not just making a brief visit. Inpatient care includes meals, nursing support, and a hospital bed for rest and recovery. A prescription is an official document or order from a qualified healthcare professional, usually a doctor, that allows you to obtain certain medications from a pharmacy. People often talk about receiving a prescription after seeing the doctor. You might say, "The doctor gave me a prescription for antibiotics," or "I need to pick up my prescription at the pharmacy today." Another example is, "I lost my prescription and had to call the clinic to get a new one." Prescriptions are vital because they ensure that patients receive the correct medication and dosage based on their medical condition. A nurse is a healthcare professional trained to care for patients, assist doctors, and support various medical procedures. Nurses often provide the majority of direct care in a hospital setting. You might hear someone say, "The nurse helped me change my bandage," or "The nurse monitored my vital signs every few hours." Another example is, "My sister works as a pediatric nurse, and she loves helping children." Nurses are essential team members in the healthcare system. They not only administer medications, but also offer emotional support and education to patients and their families, helping everyone navigate the healthcare journey. A doctor is a medical professional who diagnoses illnesses, prescribes treatments, and oversees patient care. Doctors can specialize in specific fields, such as cardiology or pediatrics, or work as general practitioners. In everyday language, you might hear, "The doctor said I should rest for a few days," or "I have an appointment with the family doctor next week." Another example might be, "I trust my doctor's advice because she always explains everything clearly." Doctors typically have many years of training and education, and they collaborate with nurses and other medical staff to provide comprehensive care. A hospital is a healthcare institution that offers treatment, care, and medical advice to people with various health conditions. It can have many departments and services under one roof, such as surgery, radiology, and emergency care. People often say things like, "I need to go to the hospital for some tests," or "The hospital staff took great care of my brother when he was ill." Another example is, "This hospital is known for its outstanding pediatric department." Hospitals play a crucial role in communities, providing life-saving treatments and round-the-clock care for patients of all ages and conditions. Surgery is a medical procedure in which a doctor, often called a surgeon, performs an operation to treat or diagnose a condition. It can range from minor procedures to major operations that require several days of recovery. You might say, "I have to go in for surgery on my knee next month," or "The surgery to remove her appendix went very smoothly." Another example is, "The surgeon explained each step of the procedure before performing the surgery." Surgeries can be planned or emergency-based, and their complexity varies. This term generally sparks a mixture of anxiety and hope, depending on the nature of the condition. Orthopedics is the branch of medicine focused on the musculoskeletal system, including bones, muscles, and joints. If you break a bone or have chronic joint pain, you might visit an orthopedics department or specialist. In everyday language, you might say, "After my accident, I consulted the orthopedics team to check for fractures," or "My uncle has arthritis and sees an orthopedics doctor regularly." Another example is, orthopedics often involves both surgery and physical therapy to help patients heal and regain mobility. People with sports injuries, broken bones, or spine-related issues often rely on orthopedics for specialized treatment. Cardiology is the medical field that deals with heart and cardiovascular system disorders. A cardiologist is a doctor specializing in diagnosing and treating heart diseases. In a common conversation, you could say, "My grandfather has a heart condition, so he sees a cardiology specialist every few months," or "I am booking an appointment with a cardiology clinic to check my blood pressure and heart health." Another example might be, "The cardiology department is on the third floor of the hospital." Cardiology covers everything from routine checkups like electrocardiograms to major procedures such as heart surgeries and pacemaker implementations. Radiology is the branch of medicine that uses imaging technology like X-rays, CT scans, and MRIs to diagnose and sometimes treat diseases. If you need an X-ray for a broken arm or a scan of your lungs, you go to the radiology department. In daily speech, you might say, "I went to the radiology unit for an MRI of my knee," or "The radiology report showed that there was no fracture in my foot." Another example could be, "The radiology technician explained how to position my arm for the X-ray." Radiology plays a key role in modern healthcare by helping doctors see inside the body without surgery. An emergency room, sometimes called the ER, is a specialized area in a hospital that provides immediate treatment for acute illnesses or injuries. People often go there for urgent care if they are severely ill or injured. You might say, "We rushed my friend to the emergency room after he fainted," or "The emergency room was really crowded on Saturday night." Another example is, "You should go to the emergency room if you experience chest pain or difficulty breathing." The emergency room is a critical part of a hospital service, staffed around the clock to handle life-threatening situations. An intensive care unit, also known as the ICU, is a specialized department in a hospital for patients who need round-the-clock monitoring and support due to life-threatening conditions. In everyday speech, you might say, "My grandmother was transferred to the intensive care unit after her surgery," or "The doctors in the intensive care unit carefully tracked my cousin's vital signs." Another example is, patients in the intensive care unit often have complex medical needs that require advanced equipment. This department typically has a higher ratio of nurses to patients, ensuring that the most critical patients receive immediate attention. Neurosurgery is the medical specialty that involves surgical treatment of the nervous system, including the brain and spinal cord. A neurosurgeon handles conditions like brain tumors, spinal injuries, and neurological disorders requiring surgical intervention. In everyday conversations, you might hear, "The neurosurgery team performed a complex operation to remove a brain tumor," or "My uncle saw a neurosurgery specialist for his chronic back pain." Another example could be, "The hospital's neurosurgery department is known for cutting-edge procedures." This field often intersects with neurology, radiation therapy, and other specialties, making it an important part of advanced medical care. Quarantine is a period or process in which a person or group is isolated to prevent the spread of contagious diseases. During quarantine, the individual or group must limit interaction with others, often remaining at home or in a special facility. In everyday language, you might say, "I had to quarantine for 14 days after traveling," or "Quarantine was difficult, but it helped control the outbreak." Another example is, "The hospital enforced strict quarantine measures to avoid infecting more patients." This term has gained more public attention in recent years, emphasizing its role in maintaining public health and safety. Now that we have explored these essential words and phrases, let us take a moment to reflect on the theme of today's episode. Hospitals can be stressful places, but by familiarizing yourself with the vocabulary we discussed, you can face medical situations with greater confidence and clarity. From knowing the difference between an outpatient and an inpatient, to feeling comfortable when asking a nurse about adjusting a hospital bed, these terms empower you to navigate healthcare settings more smoothly. Our goal here is to make you feel at ease in these scenarios, because clear communication is vital for your well-being and peace of mind. Before we wrap up, I would like to thank you for joining me, Alex, on this episode of Hello Word. If you found this podcast helpful, please subscribe so you do not miss any upcoming episodes. We would also appreciate it if you could leave a review, telling others what you enjoyed and what you would like to hear next time. This helps us improve and continue our mission to support learners just like you. Remember to practice the words we covered today and keep growing your vocabulary a little bit every day. By staying curious and consistent, you will see your English skills flourish in no time. Until next time, keep practicing and keep exploring new words. I am already excited about our next episode, where we will dive into another practical and fascinating aspect of English learning. Take care, stay confident, and remember that every word you learn brings you one step closer to fluency. Thank you again for tuning in, and I will see you soon on Hello Word. Safe learning, everyone, and bye for now.